Hi everyone, my name is Caitlin Streeter and I will be presenting on my intervention project and the theory model that I feel aligns best. First, a little explanation of my group's project health outcome and targeted population so you understand the big picture before I dive into the specifics of the health outcome model. The health outcome chosen was maternal mortality, which is the death of a patient during pregnancy to 42. In some studies, they do a year post-birth or termination of the fetus. For our specific project, we're going to do 42 days. This outcome can be a sensitive topic and largely feared by past and future mothers and understood by family very deeply who have experienced a maternal death within the family. However, the rise of maternal deaths within the United States is concerning, so additional research and highlighted focus on the health outcome is warranted. The reason for maternal deaths can vary greatly with various causal factors. Some of the more common factors that you see a lot pop up in studies is independent behaviors, which we'll dive into a lot, environmental hazards, and health negligence. The targeted population are reproductive age Black women around ages 18 to 44 within Indianapolis, Indiana. Black women in Indiana face mortality rates roughly 93% higher than white women, and when comparing those with similar socioeconomic statuses, Black women still see those heightened risks of maternal deaths throughout pregnancy and shortly after birth. Higher prevalences of issues and mortalities for this population are correlated with poor diet and nutrition, lack of doctor accessibility, and transportation issues. The model that we're going to be focusing on is a social ecological model, which works to explain how health is influenced throughout various levels, starting at individual behavior and working up all the way to policies. This model was created based on Brenner's model, and this model is important because it does not only focus just on an individual behavior, but works towards understanding interaction within people, communities, and the environment. The core levels seen in the infographic are individual, that inner circle, interpersonal, organizational, community, and then policy and societal. The inner circle, individual, looks into those specific behaviors within the person that could cause a health outcome, like their knowledge, their behavior, their beliefs, their skills, genetics that they just can't control. Then each level moves into a more larger thinking more broadly, with the larger circle examining policy, like laws, public policies, and then like structural racism and discrimination that we'll talk about later also. When applying the social ecological model, focusing on multi-level interventions instead of just single-level strategies is key. This allows for an individual intervention to utilize multiple viewpoints, such as education for the population, environmental changes, and policy actions. Overall, this model helps shift blame, per se, from just the person to different aspects within their life that sometimes can't be controlled personally, and looking into those and how those might affect the health outcome. The infographic seen on the screen first goes in the overview of what maternal mortality and the target population for future interventions are. Then it shows into what SEM model is and its correlation corresponding to other theories. Finally, a visual of the SEM model figure with all levels are shown. At the individual level, personal determinants such as advanced maternal age, so being over the age of 35 when you become pregnant, obesity, so having a BMI higher than 30, stress coping behaviors like smoking, obsessive eating, lack of eating, low health literacy, so not being fully literate in what is healthy during pregnancy, unmarried status, and low socioeconomic status. And then after that, we're going to go up to the interpersonal level. This looks into social relationships. So, low social support and experiences of racism from their direct peers can increase psychological stress, reduce emotional and practical support during pregnancy, and negatively impact care seeking behaviors. Lack of supportive partners or family members may also limit advocacy within healthcare settings, increasing their vulnerability to adverse maternal outcomes. Then moving to the organizational level, racial bias in healthcare, non-inclusive prenatal care, and poor access to specialty care are noted. These environmental factors affect the quality and timelessness of care Black women receive. Bias and systemic inequities within healthcare institutions can lead to delayed diagnosis, dismissal of symptoms, and inadequate management of pregnancy complications, directly contributing to higher maternal mortality rates. So the next one will be community level. This reflects broader environmental conditions such as concentrated poverty, neighborhood violence, and limited access to healthcare facilities. These factors shape daily living conditions, increase chronic stress, and restrict transportation options and reduce continuity of care. Finally, the last circle, that large circle, is the public policy level, which represents upstream determinants, including structural racism, discriminatory social policies, and inadequate health insurance coverage. These policies influence all over levels of the model by shaping access to resources, healthcare coverage, and quality of care. These social structural inequities are embedded within the policies, and this will contribute to persistent racial disparities in maternal health outcomes, regardless of individual socioeconomic statuses. Looking into cases studies that have used the SEM model as their backbone for creating an intervention, Kelpin et al. In 2025 utilized the model to create the Miracle Project, or the Maternal Health Multi-Level Intervention for Racial Equity. This intervention was based in Michigan for African American women, so the geographic characteristics are similar to Indianapolis, Indiana, compared to somewhere like Nevada or Alaska. The intervention targeted each level of the SEM model and compared outcomes before and after its usage. The large part of this intervention was creating telehealth, which is at individual level, flexible scheduling, gets more broader, cultural fitting training for providers, community care, maternal safety bundles, and then the overall partnership with larger organizations. This intervention did a well job at adding in each level within their intervention. The SEM model does well at looking through multiple lenses instead of looking at one aspect. The theoretical model of change is another model, and this views achievement of a health outcome to be in stages where someone can move forward and backwards to the desired goal, where they can even get that health outcome and then go backwards and then have to achieve it again. This does not fit maternal mortality as a health outcome and using that for an intervention since it is not a reversible outcome, let alone many times women are not the direct cause of the complications and mortalities. Oh, another model that does not fit well is the theory of planned behavior, which focuses on attitudes, norms, and perceived control. Many women are motivated to complete healthy behaviors and positive attitudes to achieve a healthy pregnancy and delivery, but have factors that cannot be changed by themselves, like structural racism and lack of transportation. The SEM model will create a well-rounded and tailored intervention for the health outcome that is not as simple and easy to fix. So here are my references, and thank you so much for listening.